and welcome everyone from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold Learning. And I have a special guest with me here today. I'm chatting today with Dr. Marjan Khajehei. Hi, Marjan. Good to have you here today.
Hello, Christine. It's lovely to see you here today as well. Thank you.
And you are part of our Gold Midwifery Conference 2026. It's just around the corner. Can you believe it? 2026. It's
Oh
like
my God.
in a few days, and we get started with our midwifery conference early February on February 2nd, when we have our open keynote presentation that is absolutely open access and free of charge. And so you are part of our add-on package for this conference as well. And so your presentation is titled Healing the Hidden Wounds, Breaking the Silence on Perineal Trauma and Reclaiming Recovery. And I'm so glad you will be presenting on this. It's such a topic that is so needed, a little bit neglected, I often feel. But before we jump in, tell us a little bit about yourself. Tell us where in the world you are and tell us about your professional background.
Well, thank you very much. First of all, I wanted to thank the Gold panels and also you for inviting me to present in this prestigious conference. I feel privileged, and it's been a great opportunity. So I am located in Sydney, Australia. And I work at Westmead Hospital, which is the largest tertiary hospital in Western Sydney in the state of New South Wales.
Wonderful. And you are very passionate, very, very passionate about this topic, about perineal trauma. And, you even have a degree in, correct me if I'm wrong, what do you call it, sexuology or?
Sexology.
Sexology. Okay, tell us a little bit about that because I find that fascinating. And we don't, this is something of a like such a taboo topic still, right? But as midwives and healthcare providers, we need to be able to communicate well. I mean, this is an important topic we need to be able to address. So tell us a little bit about that in this point here.
Well, thank you for asking because I am actually very passionate about this topic, not only the sexology and perineal care and trauma, like the general feeling of women about the
Hmm.
whole process. Well, before I started, I did my PhD sexology. I was a midwife for 10, 12 years, and I used to talk to women about their experiences of birth, and they used to talk to me about how the problems that they have with their partners, how the childbirth has affected their like the experience of parenthood, motherhood, and their relationship.
Hmm.
So then over the years, I noticed that women's sexual function get affected after birth. Then I started researching about it and realized that there is like midwives have limited knowledge on this topic.
Hmm. Hmm.
And then I decided to do my PhD that focused on women's sexual function during pregnancy and after birth, the rate of their sexual dysfunction and their mental health problems, the relationship issues, and all the factors that can affect their sexual function. And the results were fascinating because around 60-70%, between 60 to 70% of women reported sexual dysfunction, and it was associated with their mental health and relationship satisfaction or dissatisfaction. And After that, I talked to many midwives. And as you said, this is a taboo topic. And even when I was studying, every time that I was getting on a taxi or talking to people and they asked me, "Oh, what are you studying?" I said, "Sexology." I said, "Oh, sexology. Okay, tell me about it." And it was fascinating that everybody was like, so excited. And they said that, "Oh, how is it?" And I had to explain that what the study is about. Then after I started working in different places before Westmead Hospital, I was working in different settings. Now, I was always passionate about teaching clinicians about how to talk to women about sexual function, how to open the conversation, how to give them permission to
Hmm.
talk about not only to the women, but also to themselves, talk about their sexual function and their mental health. And Actually, at Westmead Hospital, I have run several workshops and training sessions for clinicians about how to open the conversation about this important topic.
Ah, that's wonderful. That's fantastic. It's yes, and you're so right. Many midwives we don't know enough, you know. Yeah, and in the olden days, as my daughters would call it, right? We were
Very old.
taught, okay, just do your Kegels, and then the generations even of my mothers and such, they were like, okay, it's normal after you had babies to void a little bit when you laugh or when you sneeze, and it shouldn't be like that, right? It's
Yeah,
just because I always say if that would have happened to men, we would have plenty of talk and plenty of solutions about it. But it is, I feel like women in this sense, care for women is kind of neglected in that field. So it is not as just like do your Kegels. We need to do a little bit more. We need to be better educated about what is happening, right? Um,
exactly.
what do you see in your work as some challenges and barriers when you are working with women, when you're helping women recover from perineal trauma?
Well, I think the first challenge is that the pain is normalized.
Mm-hmm, mm-hmm.
And unfortunately, women get to believe that because of the uh, like the impression from the healthcare providers.
Mm-hmm.
If they have pain after birth, we said that, oh, it's okay, that's fine, that goes away. So they stay in the hospital for 1 day, 2 days, 3 days, a week, like on average, and then we don't resolve the pain, and they believe that it's okay. They go
Mm-hmm.
home. It's not
Mm-hmm.
addressed, and then it spills the pain, it spills into all aspects of their life. The way that they treat their partner, the way that they treat the baby, and the biggest problem is that we are not open to speaking to women because we are stuck in daily routine daily
Right,
activities,
right.
and we think that we don't have time.
Mm-hmm.
So part of it, I understand, part of it comes from the challenges of staff shortage, workload. But still, I believe that as a midwife, we have to have a compassionate approach, and we have to focus on the things that we see that they are not addressed and they are also important. So I think one of the biggest challenge is that we don't talk about the things because the
Mm-hmm.
majority of the problems are resolved when we communicate, not only with the patients
Right,
in a private setting like environment, with our partners, friends, children, family,
right.
colleagues. Communication is the key
Mm-hmm.
that is missing.
Absolutely. It's communication is the key, but as you mentioned, not always easy. And also for us, the healthcare provider, not just for the, woman or birthing person that we're treating, but also for us, because maybe we didn't grow up talking about that, right? Like it is for us, it was also a taboo topic. So it is very important to, learn about it, find the right word, find the communication and channels and educate ourselves on that as well. And, one thing, and I think you will mention it a little bit in your presentation as well. Nowadays, I feel like something has shifted. There is more conversation about it, but also there is some treatment options. If you go to your own GYN or something, often you see like adverts there for laser treatments or for some certain treatments, right? So the discussion is going a little bit more open, and there seem to be some solution. But correct me if I'm wrong, but I've noticed with that, it is almost like it's always often talked about as a rejuvenation, right? And then I'm thinking rejuvenation for what? Is this more for, the man to be more visually pleasing again, or is this really benefiting the woman here? So I feel like there's also some discussion needed because we don't know enough about it, and also how these yet to really well talk about it. That's why we go to this presentation of yours, for example, but also how this is perceived by society, or how it is advertised by the media as well.
Well, I think this is a great question or the great points that you raised because sexual activity, if it's in a partnered relationship that we assume, is a mutual thing.
Hmm.
Regardless of this rejuvenation, sexual activity should have a mutual pleasure, mutual feeling, mutual emotional benefits. And this rejuvenation, first of all, helps the woman to not to
Hmm.
have pain, not only
Right,
not to have pain, but also enjoy the sexual
right.
activity and feel it. And also, if a woman is happy and enjoys it, she reciprocates it to the partner, and then she she tries to satisfy the partner as a mutual activity. So it benefits both partners, and it's not only for the sake of like pleasing men, because if a woman is not happy, if she has pain, she refuses having
Mm-hmm.
I said in my presentation, that women who had third or fourth degree tear, they are more likely to prevent being touched or kissed or
Mm-hmm.
hugged by the partner than women who had first
Yeah.
or second degree tear. So if they enjoy it, they reciprocate. They enjoy it.
Yeah.
They make the partner enjoy, and it also affects the bond that they have and their relationship.
Mm-hmm.
And if you
And
have
what
happy, I'm sorry, if you
no, go
have,
ahead.
yeah, if you have happy parents, happy children,
Happy
and
children.
children
Yes.
are raised in a loving environment.
Loving environment, correct. And one thing that you mentioned a couple of times now, and which I think is a really, really important point, you talked about the normalization of pain. We need to get away from that. Yes, there is, of course, a recovery period, but it should not be painful, long term. So we need to get away from that normalization of pain, setting, yeah, realistic expectations and recovery. But however, there should not be lifelong pain associated after childbirth.
Well,
So,
that is, yeah, exactly. And I tell you a personal experience of myself. I went to do the routine mammogram a couple of years ago, and the lady that was doing it, she was a bit harsh, and I had so much pain. And I said, "Can you just be quick, please? Can you make it just no less uncomfortable?" And she looked
mhm.
at me and said that, "Haven't you given birth yet?" I said, "Yes." She said, "You had two childbirth." I said, "Yes, I did." She said, "But pain should be okay for you."
Yeah,
So it was a
yeah,
big surprise. And
yeah.
so that again shows that how we perceive pain as a normal thing for women
Yes,
that give
for women.
birth.
Yeah, yeah, absolutely. I agree. Well, thank you for sharing your very personal story because I feel like, yeah, and you're absolutely right. So, and that person, you were doing the mammogram with was a healthcare provider as well, and a woman. So,
Exactly.
so we,
Exactly.
in overall, we need to do better. And this is great, and that's how we learn. We're lifelong learners, right? We always
Absolutely.
improve in our practice. So, Marjan, before I let you go, what are you hoping that our viewers will take away from this presentation?
To see women, like look at the women in a holistic approach, holistic way. Don't look at when you check the woman's perineum, don't just look at the surface to see, okay, if there is grace, there is cuts, there is infection. Look deep inside the woman's emotional well-being, their
Mm,
experience, their feeling, their past, their current situation, and how their life would be in the future. And talk to the partner and look at all aspects of the care and not only one aspect, and see what the woman actually wants.
mm,
Sometimes we think that the care that we provide is the best, but is it really what the woman wants? It's important that we learn
yeah.
from the patients or the people, the women that we care for, and provide the best care that is the best for
Mhm.
them, not the best care that we think is good.
Yes, yes. The best care for them, not what we think it is.
Exactly.
Well, thank you so very much, Marjan Khajehei, for this
You're welcome.
wonderful talk here. And we're very excited about here at Gold. We're very excited for your presentation for the Gold Midwifery Conference
Thank you.
package.
Thank you very much for the opportunity. Thank you.
And for our viewers who want to find out more, of course, of this presentation and all the other presentations in the lecture pack and in the conference, we invite you to go to goldmidwifery.com. You'll find all the times there for the live presentations. And this, of course, is a recording, so you can watch that then once we get started February 2nd at your leisure. And we hope to see everyone at the Gold Midwifery Conference 2026. Thank you, everyone, for watching, and have a lovely day wherever you are in the world. Bye bye, everyone.